is concerned. Mheshimiwa Waziri, with those few remarks, I wish also to inform members of the press that at the tail end of this event, you'll get an opportunity to ask questions. Please don't forget to state your name and the media house that you represent. And keep the questions to nothing else other than the scope of today's briefing. With those remarks, Mheshimiwa Waziri, let me take this opportunity to welcome the CEO of Kenyatta National Hospital, Dr. Kamuri, to make a few remarks. Dr. Kamuri, please.
Thank you. Waziri, Honorable Mutahi Kagwe, members of the board, members of the press, staffs, good morning. Today we are excited. Of course, when my boss is here, I don't talk much, but I will tell you that today is a milestone to show that as a country, as a nation, as a hospital, as a ministry, we are determined to make sure that Kenya get the quality health care that they deserve. This is a first step we are putting technology to what and where it should be. For me, is to thank all of you for coming, and we assure Kenyans that we are not sleeping to make sure you remain safe. Thank you very much, and God bless you.
Thank you very much, Dr. Kamuri. It's now my pleasure to invite the chairman of Kenyatta National Hospital to say a few remarks. Engineer Gumbo, please.
Thank you very much, Waziri, members of the press, ladies and gentlemen. Today we are here to officially open the Kenyatta National Hospital Diagnostic and Reporting Center. And what we have done, ladies and gentlemen, is really to demonstrate how we are going to use big data, connectivity, and artificial intelligence to aid real-time interpretation of CT scan images so that we can quicken knowledge sharing, early diagnosis, and management of all the medical cases that we come across. This is particularly important in this era of COVID-19. We, through this center, as we were inside there, most of you were not there, we've been able to share experiences with MTRH, Wuhan in China, real time, Beijing, France, Egypt, and we are also connected to 37 counties. I want to emphasize, ladies and gentlemen, this is the first such center in the whole of Africa. And it goes to demonstrate that our country is leaving nothing to chance in confronting and defeating COVID-19. I want to say, as the chair of the board of Kenyatta National Hospital, that as KNH, we are ready, we have been ready, and will always be ready, but Waziri, to play our fulcrum role in ensuring that we succeed in this endeavor. But I want to conclude by saying that as we undertake, because we have never had this experience before, the whole world has never had this experience before, we need the cooperation of everyone, and we will need particularly the media in conveying the relevant information and educating our people so that the simple things that we require as interventions can be able to help us confront and conquer this monster of COVID-19. I thank you, ladies and gentlemen, and I pray that the Almighty God may continue to bless our great country, Kenya. Thank you.
Thank you very much, Honorable Gumbo. It's now my pleasure, ladies and gentlemen, to invite the guest of honor, who is also the Cabinet Secretary, Minister of Health, Honorable Mutahi Kagwe. Please.
Asante sana, members of the board, members of the Kenyatta National Hospital staff, members of the Fourth Estate. Let me start by congratulating those who have been involved in making sure that this event today is successful and this center is opened. I think it is very easy when you stand out here to underestimate the significance of this moment and the significance of this building. This is a game changer in many ways, and I want to congratulate the chairman and your team for making this possible. I want to thank those who have been involved. I am told, for example, that there was an issue with power connectivity. We intervened with the Ministry of Energy, and I want to particularly thank Engineer Jiroge, the PS, because in a matter of hours, something that had been delayed for months and months was done instantly. So this cooperation throughout the country, among government agencies, amongst individuals within government, this is what we are looking for to progress. I also want to say that when I started talking about predicating our health care on technology, this is a perfect example. Through this technology, you have seen for yourselves what is possible. These things were initially just dreams, but today we have seen reality. And through this kind of cooperation and new other technologies that we are going to roll out in time, we can see how we can utilize the resources we have a lot more efficiently. For example, you have seen for yourselves that instead of sending a radiologist to every county all over the country, in the 37 counties, that, for example, that we are communicating with, CT scans from those counties can be interpreted here by just one or two radiologists. So you can see the efficiency and the gains in terms of human capital that we can achieve through the use of technology. Today, we saw how the scans can be read by individuals, by 10 or so individuals across the world. And it is not therefore. It is therefore within the realms of our imagination that very quickly we are going to have major operations being done in Kenya by our own doctors, cooperating with doctors in India, in Wuhan, in the United States and Britain and elsewhere, where the travel, where those who have been traveling to overseas countries for care can actually be done here. We can bring the doctors to the screen rather than take the patient overseas. This is what technology can do for us. And therefore, I want to once again reiterate our appreciation of the cooperation through the Chinese government, through the organizations and business creativity that is there internationally. I also want to take this opportunity to thank our medical care staff, all these people, the ones wearing white and the others who are not. I want to send a special thank you to you and to tell you that we appreciate what you are doing. We know the stress you are going through. We know the hardships with which you are operating. We know the challenges that we are experiencing, and we all appreciate that you are our first line of defense. And on my part, my job is to make sure that we do everything possible to ensure that our first line of defense, the nurses, the doctors, and all clinical officers, all those involved in medical care in this country, I want to assure you that the government is going to ensure that we do everything possible to ensure that you are protected and you are trained for protection, because if you are not there, then the rest of us are not there. And I want you to know that the president himself has given instruction, direct instruction, that we must make sure that our medical staff are as protected as can be. And I want to assure you that I will work at achieving nothing less than that. So in a nutshell, I will not be speaking on other matters related to the issues that are all facing us, the disease. I will have a meeting today, an emergency meeting today at 2:30. And after the emergency meeting, I will be speaking to the press to tell them the developments and what other measures we are going to take if the committee so decides. So for now, I want to just focus on this particular event. And if there are any questions, please keep the questions to this event.
Thank you, Mheshimiwa Waziri. Questions? Anyone with any questions? Yes.
We just wanted to know the capacity of this particular facility, and it's going to be 24 hours.
This facility, I know we are used to facilities where people are sleeping. This is not a ward. This is a CT scan center, which has state-of-the-art, top-notch facility, 64 slice, for those who know what I mean. This is a CT scan that can do those scans within 3 to 5 minutes. We have cut down our turnaround time per patients. And then on top of that, this is a 24-hour service because we are using technology to connect to other 37 counties. So wherever they are taking their CT scans, they will be relaying the images here, we will be interpreting for them, and then sending back the images and the reports. We are also going to take a notch higher. We will also be using it as a training facility. We can be training and discussing with the doctors at those 37 centers. Like now, for those people who you saw, we were discussing even with people with MTRH. We can be discussing cases. We can be teaching in the same forum. It will be a 24 hours facility.
I think there is no real other matter. Asanteni sana. Thank you.
Just one.
I'm also from KTN News, as an oversight. People are worried about you sharing microphones because we catch calls from sharing microphones in the nation and you are sharing the same microphone. One. Number two, from Kenyans basically, we need a status update. Kilifi, Kwale, COVID.
First and foremost, this is very sanitized. You can actually use it, Mark. It's safe. It's very safe. It's sanitized properly. And as for the other matter, I will be speaking to it in the afternoon. Thank you very much.
Thank you, Waziri.